Hi, welcome to Money Confidence. I'm Crystal Oculee. I'm the Chief Financial Strategist here at Confidence Wealth. And every week I try to bring a topic to you that's important that either I read about or we had a conversation in a lot of my meetings and, like what's important and it's something that should be addressed. So this week, I want to talk about 3 big expenses that you could be facing in retirement and why sometimes people just don't think about it and how you're going to get yourself prepared to make sure you become one of those people that has their T's crossed and their I's dotted. So let's go ahead and take a look at one of those expenses, healthcare cost. So healthcare cost, it is an important factor in your retirement when you are planning out your expenses. Most of the time, people think I'm on Medicare, that's all I need to worry about. And pretty much whatever I'm going to pay for, it is what it is. Well, you have to take into account of what is an average person is needing in retirement to cover the cost of basically their basic healthcare costs. So let's look at an average 65-year-old retired couple. They need about $300,000 in after-tax dollars to cover the cost of their healthcare costs if they're healthy. That means their premiums, possibly co-pays, and little things here and there that really apply to normal healthcare costs. Now, imagine if there's something, definitely in a more higher category. Let's say, God forbid, you have a type 2 diabetes. So obviously that's going to cost a little bit more. What if you are in a situation that requires a lot more visits to the doctor? So that is going to cost more. So it's important to really plan for this healthcare cost in your retirement plans and expenses. So for example, when we are meeting with our clients and we're running the numbers, we run the premium payments for Medicare, and then we actually test that against based on their required minimum distribution of the client and all their income. Is this going to take them to the next level where they're going to have to pay a higher premium? As you know, you're Maggie, so you're looking at your basically modified adjusted gross income. That is going to determine the 2 years worth of that is going to determine how much you're going to pay for healthcare cost of that premium for Medicare. So it's called sometimes IRMA. If you go above a certain point, you are going to have to pay more for that same insurance. You're going to pay a higher premium. So it's really important that you understand what are my expenses, but what is also my income? And is that going to affect the cost of my Medicare premium? And if so, have I really planned and adjusted my plan to know what that's going to be? And that is the key factor for a lot of people not realizing how much healthcare can actually cost them in retirement. A lot of times we're just thinking it is what it is, but no, put that as part of just you would put if you're traveling. You want to budget for it, you want to budget for your healthcare, and you want to know that there is enough set aside so you're not getting surprised throughout the years. Now, let's go ahead and take a look at another cost, long-term care. And I know I've done lots of webinars on this. We had our long-term care specialist, Brian, talk about this several times. And let's just talk a little bit about the average cost, right? And we're looking nationwide. So if you're one of my clients in California or in New York, well, these numbers are going to be way below what is going to cost in those states. That means the numbers I'm going to read off to you is really this nationwide average. If you are in more cities that are going to be more costly, then you have to account for that. So long-term care for anyone that lives up to 80, there's a 1 in 4 chance that they're going to need some sort of a long-term care. And it definitely is not cheap, right? So again, I'm looking at average. On an average nationwide, an assisted living facility can cost $4,500 per month. Now, also just take a look at if you are like at home and you want to have some number set aside that is going to cover hourly costs. So again, nationwide, $27 per hour. So it can definitely add up. What if you're in long-term care more than you expected? I know there are many of you that have experienced this. As you're watching this, you may be thinking about your grandparents. You may be thinking about your parents. So there are lots of people that experience long-term care and how it costs so much taking care of their elderly parents and so forth. So don't think it's not going to be me. I don't need to plan for it. You really need to plan for it. And not everybody can afford insurance or makes sense for them to have insurance, but having a plan in place that you know how you're going to pay for long-term care needs is extremely crucial, just like what we talked about, healthcare costs, that you need to really plan for this during retirement. These are the things that can really be a catastrophic issue during your retirement if not accounted for. I have seen retirements fall apart and states just like whatever you thought you're going to leave legacy behind to your heirs completely get depleted because there was no plan set in place for that long-term care. So definitely this is something you should account for. I know many times when we sit with our clients, when we run numbers, we take a look at that scenario. What if you end up in long-term care for 3 years? How would that affect you? That's normal. That's not terrible. What if you end up in 5 years? Now we're starting to see a little bit of that, feeling it in the portfolio where the Monte Carlo is not looking as great. And then when we run to 10 years, for most clients, it's depleting a lot more than they expected, even if they can afford it. They just didn't expect it was going to cost that. So for example, again, let's just say you're in California and it costs $100,000 per year. Well, if you're in your 60s and God forbid you need long-term care in your 80s, account for inflation for that. Can you imagine a decade worth of that? So $1 million in today's dollars, that could be about 1.8 million, 2 million by the time you reach in your 80s. So you can see how quickly that can be depleted out. So again, this is really important. If you haven't thought about this and you want to have a quick meeting to review long-term care options, please feel free to message me here. We'll be happy to set something up. Now, the last cost I want to go over with you, again, one that a lot of people don't think about is prescription drugs. That is something that's really important. And depending on your healthcare, for a lot of people and a lot of retirees, it can cost them a lot of money out of pocket. So since 2015, at least 1 million enrollees per year in Medicare Part D have had drug costs high enough to exceed the catastrophic average threshold, which is $7,050 in 2022. Can you imagine how much that means? You've spent more than that to go above that. So once you hit the catastrophic threshold, you either pay a small coinsurance or copay for the drug, but there's really no cap for out-of-pocket spending under Medicare Part D. It can all add up if your drugs are expensive. So you can understand why this could be really, really high if you don't account for this. So if you're the type of person that needs certain medication, we really have to account for that differently than someone that doesn't. And of course, I know there are things that creep up that we don't just know about, we can't think about, like God forbid our healthcare in the future changes. So that I understand. But there is sometimes for a lot of us where it's the maintenance. Maybe you are taking some drugs on a regular basis, and that's something that is already part of your plans, and but your insurance is covering it right now. But once you go on Medicare, we really have to take a look and see how much of it it covers. Do you really need Part D, and how much will be out of pocket for you, so you can account for that? I'll give you an example. I have a client that's on a special drug that unfortunately out of pocket for her, even with her insurances, is costing her close to $1,000 per month. And I know this is unique. It doesn't happen to everyone, but for a lot of people, maintenance, being, diabetic part 2 and all of those things, that could actually be a higher amount, maybe $5,000 per year, maybe $7,000 per year. So we don't know. So it's really important that you know and you communicate that so that we know what that cost is when we're sitting with you. So we're really adjusting for that inflation. Now, as clients, if you're listening to this, that's the reason I wanted to put this out there. So then that way on your next review, if there are things you haven't talked about your healthcare that can cost you more than you expected, that you talk about it so we can put that as part of your plan. And if you're any of our clients, friends and family, and you're watching this, or you're part of the community and you haven't really met with us yet, this is a good time to really understand your expenses. So then you can account for the 3 biggest expenses that can actually come up that you don't account for, which was what we talked about: healthcare, long-term care, and prescription drugs. So not luxuries, we're not talking about travel. We're talking about basics that you really have to make sure you account for. So that's it. today. If there's anything you need, don't hesitate to reach out. I look forward to seeing you in our next session next week. Have a good one.